Hello, this is the 2-minute warning. Please press 1 to ask a question.
I want to thank you for joining today's update. But before we discuss COVID-19, I want to first address the protests in our state and our country after the recent killing of George Floyd. To those lifting up their voices, I want to say, I hear you. I am listening. And I want to help to make the changes that we need. George Floyd's brother visited the site of the murder and spoke yesterday. He had a powerful message to those working in his brother's name. Stop the violence, end the destruction. Let's do this another way, he said. Many places did not see violence carry over from the weekend, and that's good. But some did, and we're continuing to provide state support as requested. But I say again, as I did over the weekend, we cannot lose sight of the reason nonviolent protesters are in the streets. They are calling out the systemic injustices that black people and communities of color have endured for generations. We have to listen to them right now and listening to what they are saying. We can't lose sight of another backdrop behind all of this, which is COVID-19, a cruel virus that threatens all of us, but has disproportionately struck the black people in our state and people of color in our country. We know one reason is the gap in health care that many black North Carolinians face, a systemic injustice. Another reason is that many people of color are working frontline jobs that are now labeled as a necessity when they have been all along, a systemic injustice. Another is decades of blatant and subtle racism in housing practices that has left too many black Americans without a safe place to live, a systemic injustice. As we fight these injustices, we also fight a pandemic. Today in North Carolina, we have 29,889 confirmed cases, 716 people in the hospital, and 921 people who have died. Yesterday, North Carolina marked a day of mourning for the more than 100,000 Americans whom we've lost to COVID-19. It's a somber benchmark. To combat the rising case counts and deaths, we're continuing to increase our testing and tracing of known infections. North Carolina now has 32 labs analyzing testing samples in our state. And there are now more than 400 verified sites that are collecting those samples. please go to our interactive map on the Department of Health and Human Services website to find a place to get tested. We're also tracking the state's trends and indicators so that we can slow the spread of the virus. Today we have Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, here to share an update on our key metrics, and I'll hand it over to her now.
Thank you, Governor. I'm grateful for your steadfast leadership. And as we confront this challenging time for our nation, I thank you for your commitment to equity as we work to protect the health and well-being of North Carolinians. We're now in our second week of phase 2 of easing restrictions, and we have taken a cautious approach as we've moved into this phase and in order to keep our viral spread low. We don't want to risk overwhelming our healthcare system. Today, I'm going to provide an update on our key metrics. It's graph day today. And you'll see that overall, our trends have been relatively stable. However, there continue to be some warning signs that we need to watch closely. The data I'm going to go through, as you'll see, underscores that we need to take a cautious approach and stay vigilant as we make sure to continue to slow the spread of the virus. As a reminder, we look at a combination of trends that guide our decision-making, including COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. These were chosen based on public health data and White House guidance. We cannot look at any one of these metrics in isolation, and again, we look at them at a whole package when doing decision-making. Each of these data points also has limitations, and we outline those on our dashboard. So let's move into the graphs. This first graph looks at the people who come into our emergency department with something called COVID-like symptoms. This metric serves as our earliest detection mechanism before we even get a lab test result back. Looking at the yellow line, you can see the overall trend continues to decrease. However, we saw a small uptick last week that we're going to want to continue to monitor. But overall, this is very good news. This metric continues to trend down. Moving on, this next graph shows our laboratory confirmed tests. I draw your attention again to that yellow line, the 7-day rolling average. And as you can see, our day-over-day new cases are increasing. And notably, we've seen in the past week this increase has even accelerated slightly. In the last 10 days, we have had 3 days with over 1,000 new cases reported on those days. I would have liked to see this trend starting to level, but unfortunately, it continues to increase. Now, this slide is the exact same data you just saw on the last graph of the lab-confirmed cases. But now we're just zooming in for a slightly closer look. This graph shows data since May 1st and not all the way back to March, so we can see it in more detail. But again, looking at that yellow line, the 7-day rolling average, this metric is trending up. And if you look on our dashboard, we show this both ways, back to March and from May 1st. All right, we want to look at those first graphs in the context of this next one, the percent of tests that are positive. It's important to interpret the positive cases metric and this graph together. Again, I'm drawing your attention to the yellow line, and you can see that the percentage of total tests that are positive has been level. So while we're seeing more positive cases, the percent continues to be stable, and that's good news. Our next metric here is on day-over-day hospitalizations. The yellow line shows that North Carolina's trajectory of hospitalization has a small increase in the last week. You see that yellow line with a starting to creep up. We continue to have capacity in our healthcare system to take care of people if they become seriously ill, so that is good. But we would like to see this number declining, not increasing. All right, our last graph for today is an extra bonus graph providing an update on our testing. Again, we keep talking about our testing is increasing, and if you look at this yellow line, you can see that continues to trend up. Since entering phase 2, we continue to accelerate our testing, and this past week have averaged over 10,000 tests per day. Okay, so here's where we are today. Our surveillance data, that earliest indicator, is showing a decline. That's very good news, so green check. North Carolina's trajectory of lab-confirmed cases continues to increase. It gets a red X. And while this rise is in part due to increased testing, the sustained increase also shows that we're just having more viral spread in our communities. North Carolina's trajectory of percent of tests returning positive remains level, and that's good news, so it gets a green check. And North Carolina's trajectory of hospitalization has increased slightly since entering phase 2. I've given this metric a yellow line. We have hospital capacity, so that's good, but we are trending up slightly. So we're going to keep monitoring this closely for any regional patterns that we might see. In terms of other key capabilities, we're seeing great improvements. As the governor mentioned, we now have over 400 testing sites verified and listed on our website, including new locations from CVS and FastMed. We just put out an RFQ looking to partner with businesses that are minority-owned and employ a diverse workforce to continue to expand testing. We're prioritizing new testing locations that reach historically marginalized populations that have been hardest hit by COVID-19. Our work in contact tracing is also advancing with more than 200 new hires that reflect the diversity of the communities they'll serve. This all tells us that we need to remain vigilant in our actions to keep viral spread low. Everyone needs to do their part. What you do to protect your loved ones and your neighbors matters. Remember, people can have COVID-19 and not have any symptoms. Practice your 3 W's, wear, wait, and wash, so you don't unknowingly expose people to the virus. When we wear a face covering, wait 6 feet apart, and wash our hands often, we show our family, friends, and neighbors that we care about them. So remember to wear, wait, and wash. With that, I'll turn it back over to you, Governor. Thank you.
Thank you, Dr. Cohen, for keeping us updated on the science and the data and the facts. And as you can see, there are improvement in some areas while there is work to do in others. We know this virus has been a blow to our economy, too. And as we work to get our businesses growing again, we're still recruiting more good-paying jobs for North Carolina. Just in the past 2 weeks, we've announced over 1,000 new jobs in both urban and rural communities across our state. And we'll continue to bring and keep good jobs here in North Carolina, even as we battle this virus and protect the health of North Carolinians. Now, as the weather warms and more people are getting out, they are running, reopening, or in some cases repairing their businesses. They are out demonstrating and making their voices heard. They're out working in their everyday jobs, feeding us, caring for us, delivering goods and mail, protecting us, rescuing us. And they're getting out of the house more and just trying to have some fun. As we do all these things, North Carolinians must remember that this virus is still circulating and it is still deadly. People are able to do more, and that's good, but it must be done safely and following the 3 W's, as Dr. Cohen says: wear a face covering, wash your hands, wait 6 feet apart from other people. As difficult as it is, we must not let complacency or frustration or any of these activities that we're engaged in break down our defenses against this virus. We can keep this up if we stay focused and we keep taking care of each other. Today, with me, along with Dr. Cohen, I have our Secretary of Public Safety, Eric Hooks, and our Emergency Management Director, Mike Sprayberry. Brian Tipton and Connie Jo Hutchinson are our sign language interpreters, and Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now open it up for questions, and if you can state your name and the name of your organization, we would appreciate it. Thank you. We'll take the first question.
Our first question will be from Dawn Vaughn with the News and Observer. Hi, this is Dawn Bond with the NNO. I have two questions. One is about the weekend, and at Council of State this morning, Lieutenant Governor had asked about why not having the guard out on Saturday night, and I know that the city requested it for Sunday. Do you think the city mayor and police force has handled the response to downtown Raleigh as they should? And on a different matter, the bar bill is on your desk to sign or veto, and wanted to see if you can tell us about your plans for that, of whether or not you think that you'll sign it.
Thank you. These are difficult decisions that local officials are trying to make right now. It's important that people have the opportunity to protest and to say what they're thinking. There is a lot of pain in communities right now. At the same time, I know our local officials do not want these protests to get violent. And many of the organizers of these protests very much want these protests to stay peaceful, and that's important. We have stepped up to provide assistance to communities all across North Carolina that they need, the support they need, and that has come in the form of the State Highway Patrol, alcohol law enforcement, the State Bureau of Investigation, the National Guard, which does all kinds of things for our communities. And in fact, we have a number of them activated during this pandemic. And those resources have been provided upon request. And as we go into the week ahead, those sources will continue to be provided. As for the legislation that I have in front of me, you just heard the presentation by Dr. Cohen, and looking at our indicators and our trends. And it's not time yet to enter into phase 3. And I have concerns, as I mentioned earlier, about the legislature doing this and not leaving the flexibility to be able to deal with this virus if we have a surge on our hospitals, and we hope that that doesn't happen. But I'm continuing to review the legislation, and we'll make a decision and let you know about it when we do. Thank you. Next question, please.
Our next question is from Michael Hyland, CBS 17.
Hi, Governor. I wanted to ask about the letter that you sent to the RNC today. A few minutes before you started speaking, the chairwoman of the RNC said they are going to go forward with visiting other states and cities that are interested in hosting the convention. At this point, if they want to go forward with a full-scale convention, do you believe that they should go ahead and move it to another state? And if they do, given the contracts that are in place, what impacts would that have? Thank you.
Well, first, the city of Charlotte and the state of North Carolina offered to have the RNC in Charlotte, and I was a supporter of that. When this pandemic hit, we began having discussions with the RNC about a scaled-down convention, particularly when we did not know where the situation with the virus was going to be in August. From my conversations with the president and with the RNC over the last week, the discussions about a scaled-down convention have stopped, and now they have demanded a full 19,000-person crowd at the Inside Arena in Charlotte. We've continued to say we want to talk with you about a scaled-down convention, but we cannot guarantee you that at the end of August you can have a full arena. I hope they will continue to talk with us about a scaled-down convention. We're ready to discuss that, and we're still waiting for answers to our health questions about how they would take steps to protect people, about social distancing and face masks, and we have not heard a response from that. So we cannot guarantee them that in August they can have a full arena, but we want to continue discussions about a scaled-down convention in Charlotte. Thanks. Next question, please.
Joe Bruno, WSOC.
Bruno from Channel 9. I'm piggybacking off of Michael's question. Since you're not able to provide that guarantee, are you okay with the president and the RNC taking the convention to somewhere that will?
I'm concerned about anywhere in our country where you would have that many people in one place. As I mentioned to the president in my conversation with him Friday night, I commended him for not holding those crowded rallies that he likes to hold. He's not held them since March, and that's a positive thing. And the reason for that is the concern of the health and safety of people who might come to these kinds of rallies. So I would hope that they would talk to Charlotte about a scaled down convention. I think that's the prudent thing to do. That's the thing that protects the health and safety of North Carolinians. And anywhere they would go, you really don't know exactly where COVID-19 is going to be in that particular place at the end of August. So it's prudent, just like any of these other organizations that are talking to us about holding events or opening things months down the road, that you have to have a plan in place that is scaled down and that provides for protections for the health and safety of people. And I would hope still that that's something they would do. Next question, please.
Rebecca Martinez, WUNC.
Hello, Governor. Can you hear me?
Yes, I can.
Oh, thank you very much. I'm hoping. This is Rebecca Martinez from WUNC. I was hoping to ask a question of Dr. Cohen about testing levels in the way that COVID testing is carried out. I understand that there are antibody tests as well as actual active infection tests being done, and I'm just wondering if they both figure into the overall count. And if so, are you concerned that this is going to be skewing actual infection rates and the way that the virus is responded to?
Right now, our tests that we're reporting are diagnostic tests. There is a way that antibody tests might be used as they become more reliable as we go along, but I'll let Dr. Cohen address that.
Thanks for the question. As the governor mentioned, we are only including diagnostic tests. Again, that means testing for someone who might have active infection. So we do not include antibody tests in the numbers I was reporting today or in our totals. So that is something we would collect separately. We do not do that yet at this point because, again, we're not yet at the point to understand how does antibody testing even fit into the larger picture of how we're responding to COVID-19. So the lab reporting that we do is diagnostic testing only, and that is what we are reporting on our dashboards and what I reported today.
Thank you. Next question, please.
Brian Anderson with the Associated Press.
Hi, Governor. Can you hear me okay?
I can.
Thank you so much for taking the time. I appreciate it. Brian Anderson here with the Associated Press. I wanted to ask a two-parter for you, and I'm just curious specifically, the RNC basically says that you're dragging your feet on giving any sort of guidance on how to move forward to conduct the convention, and you're saying that they're not interested in having that conversation. In your talk with Trump personally last Friday, did you have any sort of back and forth on how to safely conduct the convention in Charlotte? Also, I just wanted to know, do you have all the PPE you need? Is there anything you guys don't have from the federal government that you need right now?
Thanks for that question. First, the guidance is pretty clear from the CDC and the White House Coronavirus Task Force, and we are asking the RNC to follow that guidance. But just as we did with NASCAR and just as we are doing with other like the Carolina Panthers, the Charlotte Hornets that want to be holding live events, we're asking to review a plan that is specific to what they want to do. And we would like to see a plan from the RNC on the different events that they're going to have and exactly what kind of steps that they are going to take. What kind of social distancing are they going to put in place? Are they going to require face masks? How are they going to handle people that if they run tests to let somebody in a meeting, how are they going to handle that person who tests positive? We want to help with that, but we also want them to talk about a scaled down convention. And when they say that you have to guarantee us 19,000 people in the Spectrum Center from the for the RNC convention, that's not something that we can guarantee. We would like to continue discussions with them on a scaled down convention, but that hasn't happened. And in my discussions with the president, I did talk about wanting to scale down the convention and commended him for not holding those big rallies during this time of the pandemic. But he said that he wanted to have a full arena, just as the RNC is saying right now. We are continuing to make significant improvements in the amount of personal protective equipment that we're able to get and distribute. I'm really proud of a lot of North Carolina textile manufacturers who have changed their product line to start producing masks and gowns and other personal protective equipment that's so important. No, we don't yet have enough because we want to spread it out to a lot of people. It's very important that this PPE be available across the board, but we're continuing to make significant progress. Dr. Cohen talked about that a little bit, and you can get more specific information on our website. Thanks. Next question, please.
Christy O'Connor, WBTV.
Christy, are you there? I don't hear anything.
We'll try Katie Peralta with the Charlotte Agenda.
Agenda. Sorry to come back to the RNC here, but I just wanted to assess, based on your conversations over the last few days with the RNC, based on the trends that we're seeing in North Carolina currently, how would you assess the likelihood that Charlotte hosts the RNC at all in August?
Well, we would think that if we could come up with a plan for a scaled down convention, that it would be much more likely. We think it is unlikely that we would be to the point at the end of August to be able to have a jam-packed 19,000 person convention in the Spectrum Arena. So the likelihood of it being in Charlotte depends upon the RNC's willingness to discuss with us a scaled-down convention, which we would like to do. Thanks. Next question.
Andrea Blanford, ABC 11.
Hi, Governor. It's Andrea Blanford with ABC 11. A follow-up quickly to the RNC. What is the number of attendees that you would be more willing to allow in Charlotte at the end of August? And also, were you on the teleconference with President Trump yesterday where he referred to most of the nation's governors as weak? And what is your response to the president as far as how you feel North Carolina has responded to the violence that broke out here over the weekend? Thanks.
Thanks. We don't have a specific number. It would depend upon their plan and what they want to do as to the number of people that would be coming. Remember, it's not just one event in the convention center on the nominating night. There are a lot of other events that are occurring, and tens of thousands of people would be coming to Charlotte. So there are a lot of logistics that have to be worked out, and I know that there has been a lot of work that has gone into it by a lot of people. But in order to be able to have a scaled down convention, we need to talk about that now and begin that process. So we would look forward to hearing from them on that. But if they're going to continue with this guarantee, then that's going to be their decision. As to the comments yesterday, I will say that in that Bible that he was holding in front of the church is Jesus' Sermon on the Mount in the book of Matthew. And in that sermon, he said, "Blessed are the peacemakers." I think it takes leaders of strength to be peacemakers. And right now, we need leaders of strength who can hear everybody and who can be peacemakers in this state and in this country, because our state and our country need healing. We have a lot going on and a lot of frustration, and we need strength moving us forward, trying to bring us together. Thanks. Next question.
Kate Martin, Carolina Public Press.
Good afternoon, Governor. This is Kate Martin with Carolina Public Press. Today I spoke with a spokeswoman in a small western North Carolina county. She told me that they have 9 contact tracers and they're bringing in more people to help. They're very busy. How many contact tracers will be enough for North Carolina in the coming weeks and months? I'm wondering if someone can give me an estimate, 1,000, 2,000, 5,000? Thank you.
Our new coalition has just hired 250 to add to those who are already in our local health departments across the state. But I'll let Dr. Cohen talk about that more specifically.
Hi, Kate. Thanks so much. As we know that we're getting more new cases every day, we are trying to assess what is that ultimate workload here of positive cases. It is a moving target because, as you know, if we can keep the virus level low, we won't have as many new positives and thus less to contact trace from that. So we are trying to do and understand how many people we ultimately will need. But I think it starts back with our own actions of keeping the virus level spread low, and I just want to remind everyone of that. But we want to be prepared, and that is the work that we're doing. So not only are we hiring new folks, but we have asked all of our local health departments to say, where do you have folks who may be working on other types of public health activities? How can we pull them in to this contact tracing effort? So we are working on that right now, not just to hire new, but also to redeploy folks within those local health departments. We're doing training right now, and we want to assess once we train up this cohort, we've hired the new, and then we want to assess, are we doing all of the contacts that we need to in 24 hours from seeing the positive? If we're not, we need to scale up. So I don't have a precise number, but that's the work we're trying to do. But I think it all goes back to us making sure that we're keeping the virus spread low, because the more virus spread, that means more positives, more people that need to be contacted. So again, I think if we all do our part, the wear, wait, wash, and we are doing all that we can to keep the virus level low, we won't have to ramp up that capacity. And I think we have plenty of that capacity right now, but we are going to plan to make sure we have what we need to make sure that North Carolina is able to respond to this crisis. Thanks.
Thank you. Next question, please.
We'll try Christy O'Connor with WBTV again. Christy, are you on the line?
I am. Can you hear me?
Can hear you. Thanks, Christy.
Oh, good. I was just wanting to clarify, to move into phase 3, are you waiting for all 4 of the metrics to have a green check mark before that can happen?
I'm going to let Dr. Cohen talk about that more specifically, but not necessarily. The thing is that each one of these indicators is not perfect in and of itself. And you have to look at a combination of all of them in order to make decisions about which way to go. And we recommend listening to our healthcare experts who are looking at all these trends. But I'll let Dr. Cohen speak to that.
Thanks so much. I think the governor's exactly right. There is no one metric that if we have a green check or a red X that's going to determine whether or not we can move forward. We have to look at this in combination. And ultimately, we want to step back and understand we want to be saving lives. We do not want this virus to spread so much that we overwhelm our healthcare systems. We are in a much better place than we were back in March in order to be able to respond. We have more capacity in our system. We have more protective equipment to be able to respond. We have more testing. We have more tracing. Those are all good things for us to be able to respond. So as we look at not just those capabilities, but then we look at how those metrics layer on top of it, we're not expecting perfection. This virus is going to be with us. So it's a matter of how can we live with this virus here in our communities and do our part to keep that virus level low. That's why as we're easing restrictions, we're doing it in a measured way to make sure that we don't see a spike of virus somewhere in the state or across our whole state. Because if we were to see a spike of virus, we could overwhelm our healthcare system pretty rapidly. And that's not something we want to do because we need our healthcare system there, not just to respond to COVID-19, but to all of the healthcare needs of our state, whether that's a car accident or a heart attack. So we're very protective of making sure we have enough healthcare capacity to be able to handle COVID-19 and all the other things that we need for our state. So that's what we are continuing to watch. It's why, as we looked at the hospitalizations and we saw that tick up, we gave it a yellow line. We see an increase of people getting seriously ill from COVID-19, and that is not a good thing. But on the other side, we do have the capacity to be able to respond right now. So again, we'll look at those measures in combination. We want to do our part to keep virus level low. We do not want to overwhelm our healthcare system as we go here, and that's why we want to take these modest steps forward, see how our trends react to easing those restrictions. If we are able to stay stable overall, we can continue to make progress forward. Thank you.
Next question, please.
Our final question today will be from Rick Curl with the Daily Record.
Hello, Governor. It's Rick Curl with the Daily Record. There's been some criticisms levied by people on the street. I'm not talking about it necessarily in the media, but by citizens who are concerned that people protesting are getting special treatment because of whatever reason, that they're not subject to the 25 rule, the 25 person rule, and that there's basically, there's been some pandering to them, I guess would be, for lack of a better phrase. And I apologize for using that term, but there are some people that are saying that you're throwing a double standard out there. And how would you react to that?
Well, just as we did with the reopen protests over the decisions made on the pandemic, in our executive order, we allow for First Amendment protests to be exempted from the executive order on mass gatherings. Those protests occurred earlier, in May, and they continued to occur, and people had a right to do that, and people were gathered together and exceeding the mass gathering. And that's happening now with the protests that we've been having lately. What I'd say is this, is that it's important for people to have the right to protest. And in our executive order, we have allowed for those First Amendment freedoms. But at the same time, we want people to be careful. We want people to understand that whatever activity that they're doing, that this virus is still here, this virus is still killing people, and that social distancing, wearing a mask, washing your hands are all critically important to slow the spread of the virus. And we hope people, wherever they are or whatever they are doing, to continue to remember those. Thank you all for being with us today, and we'll be back later on this week.